So a view from a clinical side, we're going to introduce Dr. Judith Reid, who's a Paediatric Associate Specialist, Chair of the Northeast and North Cumbria Children's and Young Persons Network. So it's good to have a clinician's perspective as well. So over to you, Judith.
Okay. Hi, my name is Dr. Judith Reid. I'm a diabetes clinician looking after children and young people living with diabetes in Gateshead, in the northeast of England. I'm also the chair of the Children and Young People's Northeast and North Cumbria Diabetes Network, and I'm part of the National Access to Technology Working Group. I would like to thank Diabetes UK for inviting me to speak at today's Type 1 and Tech conference. We have just heard some powerful stories about how diabetes technology can reduce the burden of diabetes. I would like to take a few moments to reflect on the clinical perspective, the inequalities and barriers, to consider positive approaches to working together with your healthcare professional to overcome these barriers and inequities, to ensure access to appropriate diabetes technology. The real-life account we have just heard illustrates the positive impact diabetes technology can have on the quality of life for a toddler with type 1 and their family. I have a toddler under my care, diagnosed at 10 months, who is so used to having needles that she just stands still and has her pump cannulas and CGM sensors sighted. But this is unusual. I also have preschool children with type 1 who have hidden under tables when their injections are due. Toddlers graze and aren't predictable with what or when they eat and with their activity levels. For these little ones and many children under 12 years, as per NICE guidance, multi-dose injection regimes are impractical and inappropriate, and the 0.5 unit minimum dose increments with insulin pens are far too big for many to achieve the best glucose control. They are clearly unable to self-manage, and many have hypo-unawareness and require third-party intervention, even for mild hypoglycemia. Nighttime monitoring is required, and this results in sleep deprivation and exacerbates understandable parental anxiety. Parents, as a consequence, often work less than full time or take time out of their full employment, impacting on societal contributions. I hope that this family and young person will, if appropriate, be supported to access closed-loop technology to reduce their burden further. Dr. Emma Wilmot illustrates in her slide here how complex juggling daily life is when living with type 1 diabetes. Professionals, both adult and paediatric, are guided by national bodies or networks. The Association of British Clinical Diabetologists and the Diabetes Technology Network in adults, and the Children and Young People's National Network, respectively. Regional integrated care systems and their smaller clinical commissioning groups have their own regional policies, sometimes known as value-based commissioning, that guide who can access certain procedures and operations, and diabetes technologies are part of this. These policies or criteria are based upon national NICE guidance and NHS England directives, but can be expanded upon at local level to ensure these meet the needs locally, and of course, budgets and costs is always considered. For example, in the Northeast North Cumbria region, we have a diabetes devices group with paediatric and adult clinicians working together with regional pharmacy, the Northern Technology Appraisal Group, and patient voices from JDRF and Diabetes UK. Historically, we reviewed access to patch pumps and continuous glucose monitoring. We now also have a regional policy to access iPorts. More recently, we have reviewed the criteria for accessing flash glucose sensoring to include those with high HbA1cs, learning disability, and pregnancy. Updated pump value-based commissioning criteria is soon to be published and will allow apps to be purchased to facilitate equitable access to closed loops. We advocated for this by highlighting that for children 6 years and under, there is no licensed alternative without the app as part of the system, and that there was a regional inequity on an age basis. At times, there may be cases that don't fit the criteria, and then we look to see if we can submit an individual funding request, and working together with your healthcare professional will give the best chance of this being successful. Evidence that might help to support these requests or to see if you meet the criteria are really helpful. Downloading regularly and reviewing your glucose levels, doing screenshots of downloads that show significant events, looking at HbA1c and time in range. A HbA1c on target does not necessarily mean you have an optimal time in range to minimise adverse health events. Hypoglycemic episodes, particularly nocturnal and unrecognised, also known as hypo-unawareness, is very important to highlight. Report what happens if you try to improve your glucose levels. What are the barriers to you improving the time your glucose levels are in your target range? Identify if you are extremely sensitive or resistant to insulin. Is needle phobia a barrier for you? Do you have severe injection site problems? Are you restricting your carb intake because you don't want to inject? Is this impacting on a child's growth? Are you losing weight because of insufficient insulin? Are you struggling with type 1 disordered eating? Are you playing sport at an elite level? With your clinician, you can relate what this all means for you in terms of quality of life, risk of complications, increased risk of hospital admissions, societal costs in terms of educational attainment and time off work. Access to technology can then be related to long-term cost savings to the NHS and society. This will all help your clinician with submitting an application on your behalf. Your voices do support clinicians to advocate on behalf of yourselves as individual patients, but also to support us with advocating for equitable access for all on the basis of geography, ethnicity, and age. It is also important that once a decision is made to switch to a form of technology, this is done in a safe and timely manner. The choice of technology offered in your locality may not be just down to commissioning. It may be related to the training and workforce capacity of your diabetes multidisciplinary team. Patient safety is paramount, and starting technology involves education. Not only for people living with diabetes, but for your healthcare professionals too. As technology advances rapidly, and to provide you with ongoing support to ensure optimal use of diabetes technology and access to ongoing funding. At a national level, we are encouraging hospitals and commissioners to sign up to the NHS supply chain, which is a pricing structure for the purchase of diabetes technology. This will support equitable pricing on a geographical basis. This will hopefully enable us to have a stronger voice when negotiating with technology companies to facilitate not only best pricing, but support packages such as adaptations for different ethnic communities, which will benefit patients and families, and healthcare professionals to deliver safe and sustainable technology services. It will also support negotiations for a single platform for downloading and viewing data for diabetes tech devices, which will make clinical teams more efficient. It is essential that as clinicians we advocate for all patients. Some people or families living with diabetes are able to advocate for themselves or their young person effectively and have the tenacity to do so. But others, due to cultural reasons, deprivation or mental health, may not be in a position to do so. 2021 into 2022 is an exciting time with the national closed-loop trials, which is to inform NICE on their technology appraisal of closed-loop devices, hopefully widening the access to this technology. DigiBeat have been commissioned by NHS England and are working with the Children and Young People's National Diabetes Network to develop resources to support the access to tech. Look out for the technology comparison guides in the near future. COVID, although devastating in so many ways, has highlighted the importance of embracing technology to improve health outcomes. It has identified the gaps in accessing technology, and charities have been set up who refurbish computers, phones, and support with internet access. Speak to your healthcare professionals about what is available in your area. We also need to remember that we are privileged in the UK and that there are some living with diabetes in the world where access to insulin is their priority. Working together, we can also advocate for consumables to be greener and recyclable. There are limited resources within the NHS, but we need to ensure there is access to the appropriate diabetes technology for people living with type 1 diabetes.
Thank you, Judith. As ever, very eloquent and very nicely put. So much appreciated. And I think from my point of view, big shout out to all the paediatric teams, networks doing their work. We are now actually working quite closely with all the networks and all the staff. So we keep talking about access, and one of the key priorities going forward, because we're now formalizing a lot of the process as to how we're doing, is about access. But I think an important point there is access which is based irrespective of your deprivation, where you come from or your ethnicity, etc. So lots of work is going on that. Judith does highlight some of the issues.